I wanted to talk about a condition that was expressed and brought forward in front of Abu Sadiq, one of the believers, and actually there have been many since who have benefited from this treatment. But it was a question related to something that can be distressing, very distressing in fact, and I've seen many cases of it in my professional life as well as in terms of the believers here. And that is a condition that affects about 2% of the global population. So put your calculators out. I mean, it's if we are roughly 7 to 8 billion people, then we're talking about approximately 150 million people who have this at some point in their lives or who are suffering from it currently. So it is a big problem, and like I said, a distressing one, and that is the condition known as alopecia areata. So no doubt it's a Latin word of some description, but what it means is the thinning and loss of hair, and areata you can probably deduce from the word is in a localized area. So this is in contrast to the hair loss that is called the male pattern baldness, and the two are completely different. The pattern of hair loss that you get in alopecia areata, you have these very well circumscribed lesions that appear on the scalp predominantly, although it can happen in its more severe cases where you have patchy hair loss on other parts of your body. It could be the beard of a man, the eyebrow, it could be anywhere on the body. So it gets more and more severe. So alopecia areata is usually the beginning of the process where you have patchy scalp hair loss, and then you go to the type that can affect your face and then the rest of your body as well. And it is something that is triggered, we believe, by an autoimmune response. It's a phrase I use a lot on this show. It's because we've seen a takeoff of these autoimmune diseases in the last, I guess, quarter of a century in particular. Things like rheumatoid arthritis, things like psoriasis. These are the immune systems gone haywire, starting to attack the body. And if it attacks your joints, we call it rheumatoid arthritis. If it attacks the pigment in your skin, we call it vitiligo. And if it attacks your hair follicles, we call it alopecia areata, depending on the severity of the condition. So it's totally different from the male pattern baldness. Usually male pattern baldness is the result of certain genetics. It appears in men usually around the age of 30 and over, and you will see that loss happening in that characteristic area at the top of the head and the hairline, the receding hairline, and it's kind of genetic and hormonally determined, whereas alopecia areata is immunologically determined and can happen at any age to any gender. And let's bring up a couple of pictures that demonstrate what I'm talking about, and I'm sure there are people watching who have had members of their family suffer from this condition. So there should be a bunch of pictures. So we're starting off here. This is how it normally starts off, and you will see a patch of hair loss somewhere on the scalp. It could be anywhere, but this is typically what it would look like, and you can see very clearly there's an area that's missing in a kind of a circular shape. There is no inflammation of the scalp. That's a really important distinguishing feature, because there are certain conditions that cause this type of hair loss, but you will see a thick, inflamed, reddish brown kind of skin there, but you can see the scalp. It's very clear. And this is how it progresses. So you can see further patches, and if you continue, you can see a case that is more severe. And it should be the next image. There we go. So this is, you can tell if this is in a young child or in a lady in her 20s or 30s, or indeed in a man of any age, really, to be honest. It can be very distressing, and people often seek medical help to try and treat this problem. And we treat it because we use our knowledge of the pathogenesis, the disease process that causes this manifestation of hair loss, which is parts of the immune system that we find when we take biopsies in these cases. In the hair follicle, you'll find what we call infiltrates of the immune system that have attacked caused inflammation and the death of these hair follicles. And the good news is that unlike male pattern baldness, over time, over a period of time that no one really knows, there is no accurate measure of time, but the hair does eventually grow back. And but would anybody want to live like that for 6, 12 months, 1, 2 years? I don't think so. And this is why people often consult with their doctor, who would give them treatment, which is the treatment that is probably known well, which is minoxidil or Rogaine, Regain. It has different names depending on the company that makes this active medicine. And this is where you apply a kind of a solution to your scalp, and it works by causing vasodilation or blood vessels or blood supply to increase in that area, as well as a couple of other things that basically promote hair growth, and also the application of potent topical corticosteroids that work by inhibiting the aggressive immune response in that area that we feel causes the hair loss. So it does have a very interesting kind of method, the way it manifests. And the treatment is hit and miss. In some cases, you'll see the follicles and the hair begin to grow within a couple of months, and in other cases, people could be using it for several months and there's no response. So it's a hit and miss treatment. But you can see how it is treated. And by the way, if you are somebody or you know somebody who has alopecia areata, it's probably a good idea to also get a blood test to exclude other autoimmune conditions, because they tend to happen in people who are more prone to them. So for instance, if you have alopecia areata, maybe you're more likely to have eczema or another autoimmune disease like vitiligo, where your skin basically loses its pigment and turns white again in patches, and then progresses to cover most of the surface of the skin. So that's probably a good idea. And also to get yourself looked at for certain important things in the blood, like iron is important, B12, folic acid, and to rule out any kind of deficiency. Zinc is also sometimes seen in these individuals. They have a slight deficiency in. So it's good to get a blood test done to be sure if there is any thing that's lacking in your blood that may be causing this to happen. So without further ado, what is the treatment now from the medicine of the Mahdi? So Abba Sadiq, from his piece, gave us some natural ingredients. It's a trinity of treatments. It's a trilogy that you use together to treat this condition. And we saw some phenomenal results in those who have tried it. So if minoxidil, or you've tried the medical things from your doctor and it's not working, then this is the important part where you tune in and you take notes, because the Riser, the Qa'im, the Mahdi has shared this traditional remedy with us, and let's go into it. Let's bring up our first key ingredient into treating alopecia areata. So yogurt is the first one. Now, yogurt has been known for a very long time in various traditions, medical traditions, in traditional medicine. In India, in Greek medicine, it's yogurt that is full fat. It has to be full fat yogurt, and we don't want anything with sugared or flavored yogurt or any full fat, with fat removed.
Jam mixed into it.
Jam mixed. No, don't do that. That's going to cause a lot of problems. We have to have full fat yogurt. It doesn't matter if it's Greek yogurt or any type of just unsweetened full fat. Moisturizes and softens the hair, minimizes any kind. So it's a nourisher of hair, and we all know that there is probiotic bacteria in yogurt, and this is also very beneficial at reducing inflammation. You know, the good gut bacteria is the lack of it rather is a cause of so many gastrointestinal diseases that I cannot begin to tell you the importance of it. And one of the great foods that you find it in is yogurt. It replenishes the good, and it helps promote the good bacteria to grow, and these oppose the inflammatory and antioxidant effect that you would find, the oxidative stress rather, that would be caused by the bad bugs that we don't want. So yogurt is a key ingredient in this thing. It says yogurt regulates sebum production on the scalp, and it helps to balance the pH level and improves scalp health and prevents hair follicle clogging, thus reducing hair fall. So this has been used in Ayurvedic medicine for a long time, like I said, and it's one of the 3 ingredients. Now, what is our next key ingredient? Let's go to the next image on the screen. And yes, it's garlic back there. This is garlic and cloves of garlic that have been crushed into an oil being applied to somebody's scalp who has a small area of hair loss. Garlic is packed with antioxidants and other things that nourish your scalp. You can see that it has this antioxidant effect that strengthens the hair. It again prevents that clogging of these follicles that stops the hair from coming out, and it reduces inflammation. It's a very potent anti-inflammatory antioxidant and particularly beneficial for your scalp. So that's the second ingredient. What's the third ingredient? What do we have? There you go. So this is the thing that you clean the area with. It's olive oil soap. You can actually get very good bargains online. Online with the olive oil soap. It doesn't have any of the chemicals or added ingredients that can actually trigger a negative immune response. We know olive oil is tremendously good for your scalp and skin in general. Abu Sadiq said that olive oil is one of the best things that you can apply to your skin.
Such a good soap.
And the soap version, I've tried this as well myself. It is incredibly good. If you somebody who gets lots of skin allergies to the chemicals that they put in soap, and there are a lot of them, then why not consider olive oil soap or one of the natural soaps? Now, how do we do this? So I made a little list of some a way that you can prepare and treat yourself. So this is the important time to take notes, and what I think I'll do is I'll put this list of instructions maybe as a link on the website or on our YouTube page of Medicine of the
description of the episode.
Let's do it. So what I want people to do is you grab 2 or 3 cloves of garlic and you crush it. You make sure that it's absolutely smooth. Then you add 2 tablespoons, the large spoons, of full-fat yogurt, which is unsweetened with no additives. Then this part is optional. If you want something, because garlic, the reason why this works so well is because garlic can actually also have an irritant effect because it's strong, right? It is an anti-inflammatory. So the yogurt also has this cooling effect. It makes this paste. So if you want to further reduce that, or if you have a sensitivity to garlic, then what you could consider doing is adding a little bit of olive oil to the mix to make it just more into a paste that is a little bit lighter on your scalp. But if you don't have any problem with the garlic yogurt mix, then just stick to that alone. For those people who do, they can add a little bit of olive oil and it'll just take off that irritant effect of the garlic. So what is the application process? You prepare the garlic, like I said, crush it, let it sit for about 5 to 10 minutes so that there's this chemical that comes out. It's called allicin, and this will come out if you let it sit for a while. So next thing we do is, like we said, we mix it with the yogurt, we turn it into a smooth paste, and then we do what we call a patch test. Now, just in case there's a reaction, you apply a small amount to your skin on your arm and let it sit there for a few minutes, and then clean it off. If there's no redness or inflammation or wheals being formed, then you know it's good. It's good to proceed to the scalp, because the scalp tends to be a little bit more sensitive than the skin on there. So the patch test is a good idea to do. Then you basically wait for about let it sit for about 5 minutes before you apply it to your scalp. Then you apply it to your scalp, and you basically, the area where you've had the hair loss, you apply the mixture of garlic and yogurt onto it and let it sit in that patch for about 10 to 15 minutes. Make a smooth application on like a mask that you would on your scalp. Let it sit there for about 15 minutes, and then you would clean it away. And the way to do that is to obviously get a little bit of water, just remove it, and then use olive oil soap. And this is where the soap comes in, is that you rub it gently into your scalp and then you wash it off with that. And that would get rid of anything else and also have this nice nourishing moisturizing effect that the garlic and the yogurt test. And it also gets rid of, by the way, it helps to get rid of that smell as well that can sometimes linger after you have cleaned it off. So that is a very important part, and that's step 3. So apply it to the affected areas as much as you can. You know, if you do the treatment once a day, that's great, but it has to be done on a daily basis, and this requires perseverance. So, but it's 15 minutes. I think people who have alopecia areata, then it's definitely a better idea than potent corticosteroids that are actually absorbed through your scalp from getting in your body and creating all the side effects. So there's a question about honey. Honey is not a part of the treatment. Are soaps and things like this made with honey good for your scalp? again, there's not much evidence to be able to say so. If you have found some research that indicates that, we mentioned honey in terms of wounds and burns being extremely effective, but is it for alopecia areata? That's the question, and honey is not a part of the equation when we talk about this condition. Honey in general is very, very good for you. It is loaded with antioxidants and many other chemicals that are beneficial to the immune system. So that is our treatment for alopecia areata. If you want to put it to the test, you're more than welcome. The results usually appear in 2 to 3 weeks, where you will see in the area small hair follicles beginning to generate the smaller hairs that come through.
And there have been testimonies of people in the community who've done this.
Yes.
And they've actually said that hair started growing back in 2 to 3 days.
There you go. So it's incredible.
And there's no harm in trying it out, is there?
Yeah, if you do it properly. And I think a good time to leave the mix on would be something like 20 minutes. Again, if you're somebody who's feeling the effects of a burning sensation or anything else, you can take it off quicker. But most people have reported absolutely, people who have used it have not reported any sort of problems with this treatment. And I think they've had better results than they did with the application of minoxidil, which is something else that promotes hair growth through vasodilation, like I said. So yes, if as a bare minimum, it should be done at least 3 times a week. That's the bare minimum. Do it. Let us know the results. Let us know your feedback. And if you have any questions, we would love to know. Yes, it's always good to get feedback, and this is a great remedy. It was given by Abu Sadiq to the believers to treat this condition called alopecia areata. So I hope you benefited on today's episode of Medicine of the Mahdis.
Yes, that was really interesting. Thank you so much, Dr. Irfan. And I'm sure a lot of people are definitely going to try this out. I mean, it's so simple, and you see results within days. My goodness.
Yes.
How incredible is that? We've come to the end of our show for today. Thank you for tuning in this morning, and we'll see you guys again tomorrow morning for another episode of Rise Up. Until then, Assalamu alaikum wa rahmatullahi wa barakatuh.